Hi, Facebook friends. Helen Archontou here, CEO of the YWCA of Northern New Jersey. So happy to have this time with you today. It is Wednesday afternoon, and we are here having a key conversation today that is rooted in our Why Women Vote campaign. As those of you who have been connected to us on YWTV know, one of our initiatives this year of 2020 has been prepping and engaging in the conversation about the big election that we have in November. And sometimes when we talk about the big election, we think about the presidential election, which is one of them. But there are many key elections that are happening in November, and all of them, all of the people you vote for have a tremendous impact on issues that have been identified to be important to women. Our national organization, YWCA USA, put out a report this year, Why Women Vote, which we will link here for you to be able to access. And in that report, it identified and did a deep dive look at a number of issues that were key for women in this voting cycle. One of these issues was related to caregiving and for parents and for our older adults. And so we are so grateful today to be able to have Stacey with us, the Director of Care Management and Generations Counseling and Care Management with us. And so she will talk with us about this issue, help us understand it better, and also give us some information about services and resources for any needs for seniors and caregivers in our life. So welcome, Stacey. So happy to have you with us.
Happy to be a part of this. This is something very important, and I'm so happy to be part of the discussion. So thank you for having me here today.
Well, this is one of these discussions as we talk about that unless it's impacting your life immediately, the reality of it is it's probably coming and will impact your life at some point. So you may not be aware of some of this if it's not presently impacting your life. That said, before we jump into the conversation, I want to tell all of you a little bit about Stacey. She is a social worker like myself. She has her master's of social work from New York University, which she received in 1998, and she started her career as a director of social services in various long-term care systems throughout northern New Jersey on a full-time and a consulting basis. Since then, she's held the position of Director of Community Relations, Marketing Manager, Senior Social Work Manager, Executive Director, and National Director of Social Work Services and Chaplaincy at Care One, Genesis Healthcare Center, Cedar Crest Village, Emeritus Senior Living, and Care Alternatives Hospice, which pretty much covers a big gamut of who we see here in New Jersey. So that's this makes the conversation even more rich. She has had a private practice as a geriatric care manager for several years prior to joining the team at Generations in January of 2015. So actually, I'll let you share this. Stacey, tell us a little bit about the mission of Generations Counseling and Care Management.
So as care managers, and it's funny, one of the most difficult questions I think I have to answer during the day sometimes is, what is a care manager? Because it's something that's it's so encompassing of so many different things that it's hard to answer in a snapshot. I've often called us the general contractor of changing care needs, of senior care, and also just changing care needs. We work not just with older adults and their families, but we also work with families with special needs, younger adults. So we really serve the gamut of changing care needs, as I call them, not just aging. And we're there to do comprehensive assessments, to help be a hand to hold and a professional guidance, and to help navigate this system that unfortunately there's not. And I think part of the reason is because we're not as comfortable talking about this. This is not something that's you're chit-chatting with your friends about as much. And this is not something that is as readily available to get access to information. It's so important to access your professionals to do the assessments and to have some guidance, because these are life transitions that are more challenging than others to approach, and not always with clear-cut answers.
Yeah, and I mean, I can share from personal experience, and I've shared this, before on YWTV. I care for my soon-to-be 90-year-old mother. And she's moved in with me as of March as well. So on top of caring for her for these past few years, and more recently being much more involved in her daily activities, for sure, I can absolutely reinforce that this is very stressful, not only for the caregiver, but also for the person that you're caregiving for.
Right.
They very often do not want to be a burden, want their, normal life, back. And it's a transition for them. It's a transition for the caregiver. And there's a continuum, as we know, of,
Absolutely.
where this could go to depending on the, health and longevity,
Right. Right.
of that individual. So, with all of that, um, as I said, there is a continuum, right? Everyone doesn't go right into,
Yeah.
going right into one of the many, potential facilities that, you've worked at. Can you tell us a little bit about how a family member and how that older adult makes that decision about when to get some of that care at home and when to move in with family or to move into assisted living,
Absolutely.
how they go through that process?
It's a great question. It's a very important question. And I wish there was a very easy answer to that. And I think, so obviously sometimes there are these critical events. There's a bad fall and someone's in the emergency room and there's been a long hospital stay, they're in rehab, and you have somebody standing in front of you saying, mom or dad can't go home. They're not safe. They can't be alone. And it's obvious. They're no longer mobile. They're wheelchair bound. They're bed bound. There's been a significant change that's glaringly obvious to everyone. And you're being told by someone it's unsafe. Or because of a medical diagnosis, they're bedridden and there's an end stage disease and you're bringing hospice in. And again, it's clear cut and someone's, saying to you, this is what's happening. And those are certainly challenging in their own way, but sometimes easier because it's a little bit more clear cut. More often than not, these changes are gradual, and it's not as obvious, and it's not this critical, okay, this is the moment. There are maybe changes that you're seeing. I think one of the important things to identify is this is a life transition, like so many other things. Going to college, getting married, buying your first home, having a baby. But unlike those events where, when you think of anyone who's gone through the college search process or you're about to go through it, there's this template, junior year in high school maps it out specifically. This is when you take your SATs. This is when you get your tutor. This is when you look at schools. Everything is mapped out. And, there's not that exact template for senior care, for changing care needs. There's no say yes to the nursing home. There's no like there is for say yes to the dress for wedding. There's not this excitement, there's build up. When you think about this as a life transition, there's not that same anticipation that you've had for other life events, other transition events. And I don't call this aging, I call it changing care needs. And that's really critical to think about because there's not any one specific age. I've had clients in their 40s, 50s, and 60s with changing care needs that we need to address. And I've had clients well into their 90s that are 100% independent and living their life and doing everything great. In my own world, my grandfather was in his early 90s and still traveling Europe with his girlfriend. So it's not about an age, it's not about a number, it's about changing care needs. So more often than not, there may be small things that you're noticing at home. Maybe the person, your loved one, is not inviting you over as much or not inviting you over at all. When you go to pick them up, they're waiting outside. So concern may be what's going on behind the doors, what's going on at home that they may not be able to manage anymore and they don't want you to see. Certainly weight loss, if they're wearing the same clothes over and over, if you're noticing changing in body odor. So again, sometimes there are these obvious changes. I think one of the most important things that we can do, and especially, and yes, I say we as women, not just because that's more the focus of this conversation, but I think we as women are more a part of this in our families, is to try to make this more of a comfortable part of the dialogue. The reason why those other life transitions are easier are not just because they're more fun. Looking at colleges and getting married, those are certainly more fun, but part of it is because there's the dialogue around it. There's the conversations that you've been having. There's the anticipation of it. There's the planning for it. So I think if we get a little bit more comfortable in talking about this with each other, with our families, with our children, with our parents, then it's more comfortable to say, you know what, I'm noticing this in myself. I think I need some help. And I think that's something that, we can start as soon as possible and really immediate. You don't wait for there to be something to happen. You start being more comfortable having these conversations with your family members. My kids tease me that, and certainly they've grown up with me working in this business. So these conversations have been a part of my family, dinner for years, whether they like it or not. And it's become a joke, but also there's a level of seriousness to it. And there's a comfort in talking about it. I know most people are not going to get to that same level of comfort as my kids have with saying, yes, Mom, we know you just want the sing-alongs when you need to be somewhere. But at least be more comfortable talking about it with our friends, with our family members. I think that's really a critical part of identifying this transition.
Yeah, I have to agree. I think waiting for there to be an event,
Mm-hmm.
is really challenging because there's so much emotion around that, and
Right.
being able to, to handle these things and talk about them, when
Right.
things are not at that level,
Right.
definitely allows for better planning,
Yes. And in
better
living
planning.
with professionals, I think, this is one of those times that you look towards professionals to really help get that comprehensive assessment and understand exactly what's going on, and what your options are. Because again, there's not one right or wrong answer, and that also makes this more difficult. And there's not one time that you're going to say, yeah, okay, I feel good about this decision. This is one of those decisions that you may not feel good about because of all of the emotion and all of the meaning behind it. And I think that's important to identify as
Yeah.
well.
I think, and I can speak again from my own personal experience, and talking to others about the topic. Even due to this issue that we've been focused on for the YW. Two of the conversations that I think are the hardest to have with the older adult in your life that you are supporting, are one, when they stop driving.
Mm-hmm.
I know, that was a very, very defining moment for my father. And quite frankly, he was declining prior to that, but he dropped significantly once that independence, was taken away from him.
Sure.
And I think the other one is that conversation about putting them into some assisted care facility.
Right.
These are both conversations, if you are having them, that they say, please don't take away my license.
Right.
Please don't put me in some facility
One of those places. Right.
places, right? And so, what tips do you have for those of us that are in the situation of, having these conversations, how to approach them,
Okay.
in a way to be able to, create a transition that is less, emotional and chaotic?
Okay. So one of the first things is, and I feel this personally and professionally, many people have said to me, oh, so I now have become the parent and they're the child.
Yes.
And I cringe when I hear that, honestly. Because I think one of the most important things we need to remember is that, and when you're a parent, when you're a parent, you've said to your child, you'll always be my baby, right? And I think our parents do need to feel that we are always their children. And as children, we need to feel that. And I think there's a part of us when we're interacting with our parents, when even as adults and having our own adult children, we are still their children. And very often when we're interacting with them, we're basically 12. So I think it's important to maintain that boundary because parents need to still feel like they are the parent, and we need to feel like we're the child, and that's okay. And I think that's the first mentality to reset if you've reversed that, is that you're not becoming the parent. You're just there to now support your parent in a different way or guide them. And again, certainly part of it depends on if there's significant cognitive impairment. But I think that's the first step. So when you're then sitting with your parent, it's a dialogue, it's a conversation. You're not just saying, "Well, you can't drive anymore because I'm in charge now." Nobody likes to feel that. No one likes to feel like they've had all of that control taken away from them. So as much as possible, leaving options, talking about things, explaining concerns. Another important thing to remember is that um, people have the right to make bad decisions. And that's another one that people kind of are shocked at when we hear it. It's one of the first things I learned when I started working in long-term care. And I learned it from somebody who was doing a state survey. They worked for the Department of Health, and we were talking about someone falling and what to do to prevent the falls. And they said people have the right to fall. People have the right to make bad decisions. And it doesn't mean that they have the right to hurt somebody else, and driving opens up a whole other thing. But I think recognizing that just because somebody is doing something that may not be ideal doesn't mean we just take away all their independence. And I know in watching my mother and my aunt with my grandfather, one thing I really learned was just how to really recognize that continued dignity and independence is so important in that conversation. So I think that's first and foremost, is getting yourself in that right mindset of approaching the conversation, being open and sharing concerns, and sharing them, not doing things behind their back, not just taking things away. Um, if they are significantly cognitive impaired, that's a slightly different conversation in terms of taking keys away and things like that. But as much as you can, involving them in the conversation and sharing the concerns, being open, asking them how they're feeling about something, what their concerns are, but not just coming in like a bulldozer one day and saying, okay, you've hit this age, or you've made one bad decision, or whatever it is. I think it's really important to sort of maintain that conversation and dignity and everything else. Not easy to do, but
Yeah.
like I said, the mindset, I think, is the first thing, and it gets you at least in the right frame to be having the conversations.
Yes, and I think you've given us a good framework to be able to have it in, and important things to take into account, when we're approaching, those conversations for sure. So another very difficult, of course, no one wants to necessarily end up in one of these facilities, but very often, it ends up being a necessary step for those of us who have to choose one.
Right, right.
I think about the process that we went through to identify a daycare center for our children,
Mm-hmm.
and we interviewed, we visited, we went through such a extensive process. Can you tell us a little bit about what that process should be like in terms of identifying an assisted living or a nursing home facility? And I ask that because, again, sometimes these decisions happen quick.
Mm-hmm.
I mean, obviously, when you're picking out a child care center, for the most part, you have a little time. It's a crazy time because
It's
there's
a
a
crazy
baby
time. It's an
involved,
emotional
but
time.
there's still
Right.
time to be able to plan for it. I think that's one of the challenges of this choice, is that you may or may not have the time to plan for it.
Right. Absolutely. And it's a good analogy to make because I've often actually made that same connection, because I think it's, again, unlike some of the other life transitions I talked about in terms of, looking at colleges and all of that, the daycare route has that a little bit of that same emotional pull. And I remember, when I went back to work and my son was, I don't know, 8 months, 9 months, whatever. And I looked at daycares and I found this wonderful place. And it was great. And my friend from high school was the director, so it was even better and everything else. And every box was checked off in terms of the right kind of thing and the right environment. And he went in and I loved the teachers and everything else. And I sat in my car and I cried. And I think it's important. And it wasn't about being nervous about leaving him. It wasn't about any of that. It was about there's emotion involved in it, and that this was not exactly my first choice of what would be, right? Um, so I think we have to reframe our expectations. And I use the word reframe. I don't ever say lower your expectations when you're looking at facilities. This is for your loved one. We don't ever lower our expectations. So I think it's reframing them. So not looking for this place where you're going to sit in the car and say, oh, yay, that's wonderful. And again, part of that is because all of the other emotions that are tied into this, that of what this means, of this is not necessarily what you wanted, what you planned for, what you expected. You're grieving in some ways, you're mourning some type of loss of independence, of whatever it is. So I think that's the first thing, is reframing those expectations. The most important thing is trust. I'm not a big believer in looking at places that have all the stars and everything else, because a place could have a wonderful survey and have lots of stars, and then all that staff changes and a month later is not so great. So I'm not saying don't look at those. They're important to look at, but it's not the most important thing. The most important thing is your gut. I really feel a big thing is, how do you feel when you connect? Do you feel a connection with the people and not just the admissions person? Because no offense to the admissions people, I've been there, done that. That was my job once. That's what they're meant to be doing. They should be the people that you're easily connecting with. Look at the other staff. Are they talking to the residents? Are they connecting with them? Are they talking to each other about the residents? That's always, when I'm walking around on a tour, No offense to admissions counselors who may be listening to this. I don't listen to them. I watch the other staff. Again, people say, oh, smell. Any facility at any point, you might find a smell because you're dealing with things. So you walk through a building at 3 o'clock any day, I guarantee you're going to smell something. Doesn't mean it's horrible. If you sit there for 24 hours and you always smell that, that's a different story. But again, the things that you look at, are the staff engaged and happy? Happy staff means happy residents. Are they connecting with the residents? And whether this is an independent living, an assisted living, or a nursing home, or a hospital, that's really the most important thing. Clean, yes, that's important. Fancy lobbies, okay, maybe, but fancy lobbies don't mean wonderful care. I've been in places that are almost all Medicaid, state facilities, don't look very pretty, don't even smell very pretty all the time, but the residents are so well cared for. The staff is directly engaged with them. The staff come to work all the time because I've been seeing the same ones for the years that I've been visiting there. So they're happy, they're treated well, they're engaged in their jobs. Those are the things that are going to translate the most to the good care.
Yeah. And I think that absolutely translates to the health and wellness, mental wellness and physical wellness of your loved one for sure.
Yes.
So that's wonderful advice. So Stacey, as you've given us so much great information, I'm so grateful. Thinking about the election coming up, and this, being an important issue for voters, what are some of the conversations, on that level, that you think are important for us to keep an eye on?
Mm-hmm.
And not, obviously the YWCA doesn't, we're a nonprofit, we don't endorse, individual candidates, but we are about issues. And, for us working with seniors and supporting, our older adults is a key issue.
Right, right. So I think looking at candidates that are having these conversations and not just straight kind of across the board coming out and pointing fingers. And I know, and I'm not naming it, but just, there was a lot of bad press for a lot of facilities. And I think some of it was a little unfair. So I think who's having the conversation, who's having the dialogue, who's listening really to, who's setting things up, who's going to talk to seniors,
Mm-hmm.
and not just kind of setting across the board of kind of, looking at social media and just kind of what's the pictures and sensationalizing things.
Right.
Really having these conversations. Who's looking toward the future? That's a big thing as our population is continuing to have changing care needs for longer, as people are living longer. So who's really talking about what some of these longer term plans are? It's no longer I'm going to retire, at 65 and have a few years of travel and, then whatever. People are living and working, having to work much later now. People are living much longer with illnesses. Dementia is being diagnosed younger. So again, it's not just about aging. Sometimes it has nothing to do with the number, but really who's talking about dementia. That's a big one. Yeah. I think these are really critical things, and certainly funding and payment, because no matter how much money you've saved, if you're living with care needs for 20 years past your retirement, you're very likely going to need some assistance.
Yeah.
And that's the critical conversation, is that it's, when people think of Medicaid and there's this negative connotation, or I won't need that, I've saved money, I worked my whole life. You've worked your whole life. Medicare doesn't cover custodial care. Very likely more and more people will be needing Medicaid assistance at some point. So I think those are the conversations and that you want, the questions that you want to be asking, and people who are looking and thinking about those future needs, because those generations, we are going to need that.
Right.
The aging generations are going to need that, and changing care needs. Who's going to finance that is an important question, I think. One of the most important questions. Who's going to support us?
Thank you so much for all this information.
Thank you.
Stacey, you really have, given us a great framework, for thinking about these conversations with our loved ones, for looking at these facilities, for taking into account who we're going to vote for. I'm sure you join me in asking all of our viewers to make sure that they're filling out their census. Yes. And, make sure they're registering to vote. Both of these actions are really, really key in supporting this older adult community in particular, and also supporting those of us that are caregiving for them.
Absolutely. But absolutely. God willing, we will all age, so we will all need that. So everybody should be voting and everybody should be thinking of these things when they're voting because this impacts all of us. So vote, 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 and then vote and vote.
You got that, folks? So for those of you watching, if there was someone in your life that you wish had seen this conversation that we've just had, never fear. This will remain on our Facebook page. You can share it with them later. We do encourage you to share this discussion, whether it's a piece of it, with someone that you talk to, or whether you actually, share this feed on your social media. It's a great opportunity to amplify and, get this word out to individuals because, as Stacey so aptly shared, this isn't one of those exciting discussions that has a reality show or, has a social media, has a engaged social media site and, cute hashtags and, all of these things, to make it something that everyone, embraces. This is a wonderful opportunity, though, for you to, help educate yourself. Even if you think you're not there yet, it's very likely that you will end up in a situation that you're caregiving for someone in your life at some point.
Absolutely.
So with all of that, I also want to share that if you join us tomorrow, we have another great virtual conversation on YWTV as part of our Share the Mic Now campaign. We will be talking to Amber Lee Forrester, the founder and coach of Quartz Wellness Collective. She's done some great work with us at the YW between our Women's Leadership Conference and doing some work with our girls leadership group. And she's a great voice and looking forward to helping amplify her experience tomorrow and stay connected to our social media so you can learn how to connect with her. For those of you that want to learn more about Stacey and her organization, the links are all here, Generations Counseling and Care Management. And Stacey, you're so lovely to talk to. And I can say from the stress of this all, it's nice to have a nice calming voice when you're in this experience to help you problem solve and troubleshoot all that comes up. So I do encourage anyone who's living in this experience, instead of struggling with the stress of it on your own, there are resources out there for the caregivers to help you really be that supportive and respectful caregiver to your parent or to the older adult in your life. And, having resources like Stacey in the community, really can help you do that so that, this is all handled with,
absolutely. You don't have to do it alone.
You don't have to do it alone. Right. And that's great because it can feel like a really isolating, stressful experience for everyone involved. So it's so wonderful to meet you and to know that you're out there, and we hope that people get engaged. We've attached the YWCA report here for you too, so you can learn more about,
thank you,
why women vote, and also, again, a lot of these great conversations we've had here. We hope you all have a wonderful rest of your day. Stay cool if you're in the Northeast or east part of the country, and have a great day. And we'll see some of you tomorrow. Stacey, be well. Thank you so much for
Thank you so
care.
much.
Bye, everybody. Thanks for watching.